Hey guys, Dr. Carroll here. One of the questions I get quite a bit is stem cell and PRP. In orthopedics, we call those orthobiologics. So we use it quite a bit. Typically the PRP, which stands for platelet-rich plasma, is good for tendon issues. Typical tendon issues that we deal with are tennis elbow, golfer's elbow, patella tendonitis, which is jumper's knee, Achilles tendonitis, or plantar fasciitis. There's also some things around the hand and the wrist, tendonitis kind of issues that PRP works pretty well for. The other orthobiologic that we use quite a bit is called bone marrow aspirate concentrate. These are the precursor or stem cells from the bone marrow. There's other donor type of stem cells we can use also, but the preference is to try to use your own stem cells. Typically we get those stem cells or bone marrow cells from this part of the pelvis. That's the bony part of your hip in the front, and there's also a bony part in the back that's very good for obtaining this bone marrow aspirate concentrate stem cell line of treatment. The technique is basically harvest the stem cells, spin them in a centrifuge, and then inject them into your problematic joint. For the platelet procedure, it's basically a blood draw, typical blood draw like you would get at the doctor's office or hospital for blood work. We take some of that blood and again spin it, harvest the platelets and inject them into the problematic tendon or soft tissue. If you have any questions about it, come and see me, we can talk about it. I think the main issue with these kind of treatments is they're not covered by insurance, so they can get kind of pricey, but the upside is that it's not surgery, it's a relatively minor procedure, and we always have that surgical option if it doesn't work.